Inside the world of intensive care, a closer look at critical health care. Intensive care units, ICUs, are one of the most critical areas of any healthcare facility. These units are specially designed to provide round-the-clock care to patients who are critically ill or injured and require constant monitoring and support. Inside the world of intensive care, patients are often hooked up to a variety of machines and equipment that are designed to help them breathe, regulate their heart rate, and maintain their blood pressure. The environment is highly controlled, with strict protocols in place to ensure that patients receive the highest level of care possible. One of the most important aspects of intensive care is the team of medical professionals who work together to provide care to patients. This team typically includes doctors, nurses, respiratory therapists, and other specialists who are trained in critical care medicine. Doctors in the ICU are specially trained to manage complex medical conditions and to make critical decisions about patient care. They work closely with nurses to monitor patients' conditions, adjust medications, and oversee any necessary procedures or tests. Nurses in the ICU play a particularly important role in patient care. They are responsible for monitoring patients' vital signs and ensuring that they are receiving the proper medications, nutrition, and other treatments. They are also responsible for communicating with patients' families and providing emotional support during what can often be a very stressful and difficult time. Respiratory therapists are another important member of the ICU team. They are responsible for monitoring patients' respiratory function and ensuring that they are receiving the proper level of oxygen. They also help to manage patients' airways and provide respiratory treatments such as oxygen therapy and mechanical ventilation. In addition to these core members of the ICU team, there are often other specialists who are called upon to provide specialized care to patients. These may include physical therapists, occupational therapists, and speech therapists, as well as specialists in infectious diseases, neurology, and other areas of medicine. Despite the high level of care that is provided in the ICU, patients in these units are often very sick and may require a great deal of support and assistance. Families of patients in the ICU are also an important part of the care team, providing emotional support and helping to make decisions about their loved one's care. Overall, the world of intensive care is a complex and challenging one, but it is also one of the most rewarding areas of healthcare. The dedicated professionals who work in these units are committed to providing the highest level of care to patients who are in critical need, and their efforts can make a life-saving difference.